Ready? Thank you for the kind introduction, Deepa. This is a very pertinent topic, and in fact, this topic will bring to light lot of misconceptions which people have. And this is a relatively new procedure. Many people are not aware of it. Many people are ignorant of it. And there are many elderly people who are having tight aortic stenosis or tight narrowing of the valve and who otherwise cannot undergo open heart surgery and are dying. So for them, this video will be a boon to know that such a procedure exists and they can take advantage of this procedure and help save many lives. Wait, the next question. The next question will go. The question आप काट देंगे. So the next question is, before we learn about the treatment, what is the role of valves and what can go wrong? So Deepa, coming to the question, there are 4 valves in the heart, 2 on the left side, 2 on the right side. The aortic valve which we are talking about is the main exit valve of the heart. The entire heart pumps out blood from this valve. So imagine the valve closes and opens like this. And it keeps on closing and opening at least 70 times a minute for a good 60, 70, 80 years of an average lifespan. Now, the valve can get either narrowed, which is called as aortic stenosis, or the valve can start leaking, which is called as regurgitation. The causes of that is, one is a cause which is called as a rheumatic cause, which is an infective cause. This is a disease of adolescence. At the young age, because of infection, there is a virus which infects the heart, and as a result of which, over a period of time, the valve can get narrowed or can get leaky. The symptoms of this can be the same as other etiologies. The other cause can be degenerative, that means with age. With age, imagine the heart valve which is being opening and closing about 70 times a second, 70 times a minute. Over a period of time, the valve starts becoming thickened, and because of the thickening of the valve narrows down. The normal area of the valve is about 4 to 6 centimeters square. When the valve narrows down, it becomes less than 1 centimeter square. So this is called as stenosis, aortic stenosis. Next question. Okay. So next question, very relevantly explained, sir. Now my next question is, what are the common symptoms of the valve disease and what are the tests to confirm this? Yes, Deepa. So the common symptoms of valve disease here are shortness of breath, uneasiness in the chest, and the third symptoms could be feeling lightheaded, feeling giddy, or passing out or losing consciousness. Now, very classically, the shortness of breath could initially be exertional shortness of breath. The moment you start walking, you become short of breath. Over a period of time, the shortness of breath can be present at rest. And finally, later stages, the shortness of breath can also be present during lying down. The moment you lie down, you feel more short of breath. The moment you sit up, you feel a little better. It can also have heaviness in the chest. The moment you start walking, the heaviness in the chest increases. It may radiate to the jaw. It may radiate to both the arms. It may radiate to the back. It may be associated with loss of consciousness in later stages. But it is very important to know whether the shortness of breath is because of the heart valve or it is because of the lungs. Generally, many people keep thinking that it is asthma, but later on they find out that it is because of the heart. So if you feel that suddenly out of the blue, beyond 60, you start having shortness of breath, do not label it as asthma. Asthma is a disease of adolescence. If you have shortness of breath after the age of 60, rule out a cardiac cause. Now, the second part of your question is, how do you diagnose it? Diagnosis is very easy. There is an echocardiography which is done. Echocardiography is nothing. It's like an ultrasound of the heart. and wherein we see all the valves in two-dimensional and three-dimensional structures. And in that, we see whether there's a valve which is narrowed or whether the valve which is leaky, and what is the reason for shortness of breath. So it is a very, very straightforward test. And earlier you detect it, the earlier you diagnose it, the better chances of your survival become. Next question. Next question is, what is the line of treatment for this condition? So line of treatment, if you have a shortness of breath, or if you have angina, or if you have loss of consciousness, and the diagnosis of aortic stenosis is made, the valve is narrow. So in that case, there are two options only. One option is open heart surgery, and the second newer option, which we are going to talk about in a great detail, is TAVR, or transcatheter aortic valve replacement, which is basically valve replacement without open heart surgery, without a single stitch. This is revolutionized the medical fraternity. This has been a boon. Scientists all over the world have been trying for ways and means to avoid open heart surgery, especially in such situations when the patients are very old, very sick, they are not able to tolerate open heart surgery. There was a sizable population which were not able to be benefited from open heart surgery because of various comorbidities, various risk factors. So this technique has come as a blessing in disguise. This came in existence in about 2000s, early 2000s all over the world. In India, we've been doing it in the last 5 or 6 years now with a great deal of success, a great deal of accuracy, and with a great deal of practice. Next question. I'm curious to know about this new technique. Can you tell me more about this, doctor, or TAVR? Okay, so TAVR, as we said, is a transcatheter aortic valve replacement. Herein, there is no open heart surgery, there is no incision on the chest, there is no suture mark here. What we do is we do a puncture mark in the groin of the leg. From the leg, we go all the way up into your heart through a specific hardware. Once we reach their heart, then we do a balloon dilatation, open up the valve, and then we implant a new valve. Yes, you heard it right. We implant a new valve from your leg veins and it reaches the heart. And then we see, it's a very, very intricate procedure. We see this is the valve. Once we reach the heart, then it is deployed by a remote which is controlled from outside. Now the valve is basically a bovine valve or a bioprosthetic valve which is made from the skin, and then this is a bovine valve which is implanted inside the heart, and the valve which is implanted inside the heart has an average lifespan of about 12 to 15 years. And after that, once the valve lifespan is over, though we've not seen all that happen so far, but once the valve's lifespan is over, we can do a valve in valve. That means put another bioprosthetic valve from the same TAVR and open the pre-existing valve. So this can be done with a reasonable amount of accuracy and success. So this has really revolutionized medical practice. I'll be showing you a short video as to how we do step by step. It's a very intricate process, but before that, a good amount of planning goes between the cardiologist, the cardiac anesthetist, the radiologist, the cardiac surgeon who's on a standby mode for all this to see whether the patient is the candidate suitable for TAVR, number one. Number two, to see whether the leg arteries are big enough to house that procedure. Then a detailed CT is done, CT scan is done to see the size of the valve, the arch of the aorta, the calcification involved, whether all these will result in a smooth sailing or not. So all that CT scan is done, the valve imprint is taken, the valve sizing is done, and after that the patient is called in. Once the patient is called in, the entire day probably he stays for a couple of days after the procedure and he goes home after 2 days of the procedure. The best part is the patient starts walking the next day of the procedure. He does not have any pain. There is no bypass involved. There is no suture involved. There is no stitch involved. So it is a revolution in medical science and medical technology. Next question. Okay. ये तो हो गया और के बाद वो चल रहा है एंड एक वो जो सर का जो पेशेंट का था ना, तो थैंक यू सो मच फॉर टॉकिंग टू यू। एक बार बोल के देखिए तो आवाज समझ आए। थैंक यू सो मच सर। ऐसे नहीं है तो इको हो गया। नहीं मैं लाउडनेस पे बात कर रहा हूं। Thank you so much sir, it was a pleasure talking to you and really the incidences such as these bring joys in the lives of medical professionals. You could see how well the patient in Thank you so much, sir, for your kind words and words of encouragement. It is instances such as these that bring life and joy in the lives of doctors and medical professionals. Mr. Vinod Kapoor was extremely short of breath, and to hear him sing now is really heartening for me. I've seen him from a heart functioning of 18%, severe short of breath. He could not probably complete a single sentence, and now here he is in front of us singing so effortlessly and so joyously. So the zest of life, if you are there, my friend, if you have a zest of life, and if you have the zeal to live, if you can diagnose your symptoms in time, if you can identify your symptoms in time, then we will help you make your life better and easier. And earlier you diagnose your symptoms, the better results we'll have after surgery or after balloon dilatations or whatever field what we are in. So moving on, so another thing which I would like to reiterate here, as Mr. Kapoor had mentioned, that he was not able to differentiate between whether the shortness of breath was because of his lung condition, because he being a chronic smoker, or was it because of the heart. And now in such cases, it is very important and pertinent to know that once you have shortness while lying down and sudden shortness of breath while lying down or cough during lying down, and the moment you get up, the cough or the shortness of breath becomes better, it is almost always because of the heart. Or if the cough is associated with swelling in the legs or distension of the abdomen, it is again almost always because of the heart. In his condition, I remember, as he told you, the heart functioning had dropped down to 18%, 20%, which was very, very serious. Our normal heart functioning is about 70%. So if the heart is functioning only 20%, in other words, it means car की चार में से तीन पहिए पंचर है. Car can topple over any time. There's a risk of sudden cardiac death involved. So in his case, once the valve opened up in time, we were able to salvage the valve. The heart functioning over a period of time increased, and now he's a good 55 or 60%, which is totally normal heart function. So in such cases, the diagnosis in time helped save many lives. Next question. So next question is, he's asking a frequently asked question: who all are good candidates for TAVR? Yes, Deepa, this is a good question. So who is a good candidate for TAVR? Good candidate for TAVR is a person who's had critical aortic stenosis. The definition of critical aortic narrowing or valve narrowing is if the valve area is less than 1 centimeter square instead of a normal area of 4 to 6 centimeter. This is called as critical aortic stenosis. Number one. Number two, people who are above the age of 65 who are too sick to undergo an open heart surgery. So guidelines clearly say if your age is more than 65, you should undergo TAVR and not a surgical valve replacement. Less than 65 years of age, if you have any comorbidities, diabetic, hypertension, poor heart functioning, kidney disease, liver disease, or lung condition, as it was in our case. So in those conditions also where open heart surgery becomes very risky, in such cases, we should give them an option of transcatheter aortic valve replacement or TAVR. Which conditions it should not be done? See, since this is a bioprosthetic valve degenerates over a period of time, over a period of 10 to 15 years. So if it is a younger individual less than 50 years of age, then we do not expect to do a TAVR. In such cases, surgical option is a better option. Over 50, multiple comorbidities, TAVR has to be done. Over 65, all the patients, we should offer TAVR. Now, another question you want to ask? The question is, so this pops up another question. How many days, how much time does a patient require to stay in the hospital? See, TAVR looks a simple procedure, but believe me, it is a handiwork of at least 5 to 6 specialists involved. It's right from the radiologist who does the CT scan, intricate CT scan to see what is the valve area, what is the valve size, whether we'll be able to go from the legs, whether there's enough calcium inside, to the cardiologist, the interventional cardiologist, the non-invasive cardiologist, the cardiac anesthetist, and a standby cardiac surgeon. So there's a team which is involved, which is called as the heart team. Every process is very intricate, right from delivery of the balloon to the delivery of the implant which is there. So in such cases, because we have mastered everything, there is no sutures involved, there is no stitches involved, there is no cutting open of the chest involved, there is not even an anesthesia involved. We do not give general anesthesia now. Yes, you heard it right. We do not give any general anesthesia to the patient. The procedure is done under deep sleep or sedation. So this is after getting the expertise with the regular procedures in TAVR. We decided we were among the first in the country to start the procedure under deep sedation without the need for any general anesthesia. So no complications of general anesthesia, and the patient ideally stays in the ICU overnight. The next day he's shifted to the ward. We make him walk around in the ward for 1 day, and probably after 2 nights, the patient goes home, barring any major roadblocks. Next question. So the next question is, what is the life of the valve? So since this is a bioprosthetic valve, since it is a bioprosthetic valve, and then the life of the bioprosthetic valve, which the surgeons also routinely put, is about 12 to 15 years. We have not seen anything degenerate so far, but after 12 to 15 years, procedure is very simple. You put another valve, which is the valve and valve, which is even simpler than the previous valve. So we put another valve, implant another valve in the pre-existing valve, and that is called as valve and valve procedure. And that also can be done very easily from the leg. And as far as there is no blood thinners required for a longer period of time, unlike a surgical metallic valve, wherein you require blood thinners throughout, the risk of stroke is higher, or blood test called as INR has to be done every 3 weekly. None of that is required if you are doing a TAVR now for such patients. The next question is, what is your message to the patients? So now, since we are almost about 2 decades old in this TAVR technique in India, about 5 years now, so it is what we have seen over a period of time, especially Indian patients. We tend to underplay our symptoms. We tend to underplay our symptoms, and we tend to underdiagnose our symptoms. Many times, if you people have shortness of breath, they say it's because of asthma. They start suddenly they're feeling uneasiness. They say it's because of gastritis, and they will try to put your symptoms under the carpet. So do not do that. I would request everybody to diagnose your symptoms in time. Go to your cardiologist in time. Diagnose it by doing an echo or an ECG and see what your problem are. Once you diagnose in time, you'll be able to detect in time, and you'll be able to save lives much more as compared to diagnosing a disease which becomes very late. Then the benefit accrued out of the procedure may not be that much. So with this, I think we bring to the end of the session. It was a wonderful session. Thank you so much and for being patient. And any further questions, I'm welcome. And thank you so much, people.
स्टार्टिंग में तो इंट्रोड्यूस कराते हैं
स्टार्टिंग में वो कराती है मैं सीखा हाँ वो तो मैंने बोल दिया उसी दीपा की लाइन बोल दो नहीं आप अपनी लाइन वो तो मैंने बोल दिया नहीं अच्छा वो मुझे 2 शॉट चाहिए 2 मैच अच्छा क्योंकि स्टार्टिंग में बहुत इम्पोर्टेंट है Thank you, Deepa, for the kind introduction. This is a very important topic close to my heart, and this is an essence of today. Many people are ignorant about this procedure, and there are many people, many senior people, elderly people who are dying out there in the want of surgery, who are at a very high risk for surgery, who either cannot undergo surgery because of high morbidity, mortality, and such patients are dying because of severe aortic stenosis, as this is a deadly disease causing sudden cardiac death. So now TAVR as such is a revolution in the field of medical technology. In this, we are not cutting open the chest, we are not putting a suture. The patient goes home in a couple of days, and the quality of life, believe me, is unremarkable. It is beyond comparison. So definitely, I'm looking forward to the session, and you can shoot your questions if you have. Thank you.